All right, today's all about rapid fire questions for post-op period. So travel. Travel depends on what kind of procedure you had. In most cases, we want 2 to 3 weeks of being able to see you in person, but we'll make it work. If we have an out-of-state patient or from overseas, we'll make the appropriate arrangements to make it work.
Showering. Most patients we tell that they can shower 48 hours after a procedure.
No ice packs, no heating pads. This is a common one. So we get people asking, can I use an ice pack on the incision or can I use a heating pad? You can cause serious burns in the early post-op period because the sensation is altered due to the operation.
Hot tub or baths, definitely not until sutures are out at least. And even after that, at least 2 to 3 weeks probably after that to make sure that incisions are closed.
So that I think follows the same rule as the ice packs and the heating pads, just out of abundance of caution. Exercise, we usually say in the first 4 weeks, depending on what you did, no heavy lifting, no strenuous activity, and no exercise. But again, it depends on what kind of procedure you had. A person having a tummy tuck is different from someone who's getting a lesion excised.
So supplements, make sure you tell us what you're taking preoperatively. There are some that can cause increased bleeding, so we need to know.
To cover the wound or not, right? We get that a lot. It depends on where your incision is. In most cases, we like you to uncover your wound after the first 48 hours, but we'll tell you specifically what we want. But to go along with the question about showering, we want people to shower, 48 hours after, clean the area to reduce the risk of infection. So we don't like to just cover wounds forever unnecessarily.
Bruising and swelling. Most patients will have bruising and swelling after procedure, but if it's anything out of the ordinary, meaning that it's super swollen and you think that it's concerning, you need to call us and let us know.
Yep, and then finally, numbness and tingling. So again, very specific to the procedure that you had. If you had a big operation that involves us creating a lot of tissue planes or dissecting a lot to get to do what we need to do reconstructing you, you may have significant numbness and tingling that lasts for a little while. In most cases, that recovers. Sometimes you may, if you had a cancer excised or if you had trauma to the area, there might be some permanent numbness, but we will tell you exactly what to expect post-op.